Thank you. I want to thank everyone for being here today. I want to start today by unfortunately sharing some sad news. Yesterday, we lost somebody very special to the city of Boston. Bobby Joe Leister was a street worker at the Boston Center for Youth and Families. For almost 30 years, he mentored young people. He helped them build their confidence and find a purpose. He became a trusted adult to many young people who had major challenges in their life. He connected system-involved and gang-involved youth with jobs and education. He certainly loved his work, and our community loved him. He was a mentor and a friend to many. A few weeks ago, Bobby Joe was caught in a terrible house fire. The Boston Fire Department did a tremendous job battling the blaze and rescuing Bobby Joe from the building. Unfortunately, he sustained serious burns. He was hospitalized for several weeks, and yesterday he died from his injuries. I want to extend mine and our condolences to Bobby Joe's family and his friends, and to all his fellow street workers, and to everyone at the BCYF. Bobby Joe was a role model who undoubtedly saved many lives throughout his career. We are devastated by his loss. I will never forget the impact that he made. I'd like to ask everyone to please join me in a moment of silence for Bobby Joe Leister. Thank you. I have an update on the latest COVID-19 numbers. These are as of yesterday. The total numbers in cases in Massachusetts are 54,938. The total deaths in Massachusetts are 2,899. The total number of cases in Boston are 8,159. That's up from 249 the day before. The total deaths in Boston are 302, and that's 31 up from the day before. We continue to see these numbers rise, and we must also remember the people and their stories. I won't use their names to protect their privacy, but I wanted to share something that was deeply moving that happened this past weekend. A South End resident in his 70s was hospitalized with COVID-19. He asked his doctor and his social worker if it'd be possible for him to marry his longtime partner while he was in the hospital. He proposed from the hospital bed. Our teams here at City Hall rushed and got their marriage license on Thursday. They were able to spend a couple of days married before he passed away on Saturday. There are countless numbers of stories like this, stories of love, loss, and goodbyes. As we continue to fight this pandemic, we also need to take time to reflect on those who we've lost. We need to send our loved ones the support to all the people who mourned loved ones. And we need to remember every day how precious life is. I have a few updates to share with you today on our plans for our schools, our new antibody testing initiative, on the steps everyone should be taking every day to protect themselves from others. And I know it didn't feel like it, but last week was April vacation. Our students and teachers had a break from the distance learning we put in place when schools closed down. Today, remote learning is back in session. Students and teachers are logging back into their online classrooms, and instruction is starting up again. Last week, the governor announced the school buildings would remain closed for the remainder of the school year. That means that online learning will be the norm until the end of the term. The city of Boston is preparing for the likelihood of this happening. We've set up more than 2,100 Wi-Fi hotspots for homes that didn't already have internet access. We've distributed over 30,000 laptops to kids who don't have access at home. And we keep reaching out to families to make sure they have what they need to support at-home learning. We've been staying in close contact with our school leaders to understand how distance learning is going so far and how we can finish out the school year strong for our students. Superintendent Scasilius and the Boston Public Schools are finalizing plans for remote learning for the remainder of the school year. The next phase of learning from home will start on Monday, May 4th. Families will receive additional information from the superintendent later this week about attendance, grading, and scheduling. Schools will be creating individualized learning plans for students with the highest needs to make sure no one falls behind. These expectations may continue to evolve as we get further guidance from the State Department of Education and Secondary Education and the United States Department of Education. It's important to remember that our schools are more than the classrooms. They're communities. And we work hard to make sure we support those communities. We continue to serve free breakfast and lunch every day to youth and young children at 65 locations all across our city. We also have 6 adult meal sites providing grab-and-go meals in East Boston, Dorchester, Mattapan, Brighton, South Boston, Eggleston Square, which is easily accessible from Roxbury and Jamaica Plain. We've served more than half a million meals so far, and will continue serving them for as long as schools are closed. That's 500,000 meals we've served from these locations. Our schools are staying in close contact with families that need assistance. We're delivering food to the homes of students with severe special needs. We're also focused on students with social and emotional health. Going forward, every school will have a student support team to monitor students' well-being, engagement, and helping with their progress. Much of this work has been happening since the very beginning of the shutdown. I want to thank all of our educators and school professionals who are doing this important work day in and day out. We're going to continue to share more details about our plans for the Boston Public Schools throughout the week. I also want to share some updates on testing. We now have 15 test sites up and running all across Boston's neighborhoods. We created a map which shows the locations, hours, and contact information for all testing sites in the city. We're also collecting and sharing data on testing, including race, ethnicity, and neighborhood information. We've increased testing by over 30% last week, with increases as big as 57% in some areas. We are now doing universal testing for our homeless population after securing 1,000 additional tests last week. I want to thank the state for securing these tests, which were donated by Origin. Today, we take one of the most important steps to date. We are launching an antibody testing initiative here in the city of Boston. In partnership with the Massachusetts General Hospital, we will test 1,000 residents, focusing on the areas of East Boston, Rosendale, 02121 and 02125 zip codes in Dorchester. These neighborhoods reflect the diversity of our city and will give us important information about how different populations are being impacted. If these 1,000 residents agree to participate, they'll be tested both the COVID-19 virus and the COVID-19 antibodies. This information will help us contain the virus more effectively and help us chart out a path to recovery. Most of us have heard a lot about antibodies by now, but here's a reminder of why they matter so much. Regular testing, which we're focused on so far, detects the presence of the virus. It shows whether someone is currently infected. Antibodies are proteins in the blood that the body produces to fight an infection like COVID-19. They remain in the blood after a person has recovered from the illness. Antibody testing helps us see how many people have already recovered from the virus. Testing in our community will give us a better idea how widespread the outbreak really was and is in Boston. The data will help us estimate how many people will likely be infected. It will help us plan to use our resources in a smart way. It will also help us target the areas that are most vulnerable. And as scientists learn more about immunity from the past infections, antibody testing could help us identify who has a lower risk of contracting the COVID-19 in the future. This is all useful information as we think about staffing frontline workers in long-term recovery plans. This antibody testing initiative is certainly a big step forward, and we plan to expand the program in the coming weeks. I want to thank the Massachusetts General Hospital for being an excellent partner with this antibody program. Just a quick reminder about how steps everyone should be taking every day. We are still in the peak of the outbreak here in Boston. Every single precaution that you take today may be one that saves someone's life. So we're asking people to continue to wash your hands as frequently as possible with soap and warm water. Keep practicing physical distancing. Stay in whenever possible, only to go for essential items like groceries, prescriptions, or safe exercise. Anytime you leave your home or you're anywhere near other people, we're asking you should be wearing a face covering. On Friday, I reminded people to be smart when you go out to the grocery stores. Be kind and respectful to your fellow shoppers and to the grocery store workers who have been doing the frontline work since the very beginning. We ask people to keep their distance from others, get your shopping done quickly, and wear a face covering. And when you're done with the face covering, take them home to wash them or dispose of them properly, along with gloves. Do not be tossing them on the ground for other people to clean up. I heard a lot of reports from people not wearing face masks in grocery stores. The people that are working in the grocery stores are frontline workers. They're doing it and they're helping us to be able to keep food on our kitchen tables and in our fridges. So quite honestly, this is unacceptable. You're putting other people at risk. You're putting the grocery store workers at risk, and you're putting yourself at risk. If you need any help figuring out how to make a face covering at home, we have plenty of resources online. Go to boston.gov. We can't let our guard down right now for 1 minute. This is a very critical point in the outbreak. We need to stay focused, stay vigilant, and do everything in our power to slow the spread of the virus. I thank the vast majority of people who are doing that all the time, and thank you for that. I also want to give an important reminder about seeking medical attention. The governor did this as well today. We have been reminded that people, if you feel sick, you should call your doctor or 311's helpline before going to the hospital. We don't want to overwhelm the emergency departments. Many people have been listening to that message, and I want to thank you for that. But if you're having a medical emergency of any kind, you should call 911 immediately. That includes difficulty breathing or pains in your chest or any other issue that you know is serious. Our EMTs and paramedics and healthcare providers are here to help you, and they want to help you. We absolutely have the capacity to treat everyone who needs care. So we're asking you, if you're not feeling well, you know a family member that's really sick, call 911. Let a medical professional decide if it's safe for you to go to the hospital. They know what they're doing, and they're here to help you. We don't want anyone to suffer in silence. That includes people facing domestic violence or abuse. Never hesitate to call 911 if you or someone you know needs help. If it's not an emergency and you just need to talk, we have a 24-hour hotline at 311. I ask everyone's help in getting this message to the people who need it. The city of Boston certainly shows its true colors during difficult times. This is once-in-a-generation challenge, and Boston is rising to the task in many different ways. Every single person has a role to play. Many people listening today are essential workers directly involved in this response. Many people contribute to our long-term recovery efforts. Many people are doing their part to stop the spread of the virus through physical distancing. And many are helping to encourage and comfort others by spreading kindness and message of hope. I've never been more proud of our city for coming together and approaching this challenge in courage and solidarity. And I also think it's very important to recognize the unsung heroes of this public health emergency. I started ending my press conferences last week with a shout out to different groups of essential workers. Today I want to talk about the incredible men and women who answer the phones at our 311 hotline here at City Hall. The 311 call takers have a vital role. They operate 24 hours a day, 7 days a week. Before the crisis, they were responding to about 800 calls per day, which was already impressive. Since the public health emergency began, they began averaging about 1,600 calls per day. That's double the normal volume. That works out to more than 60 every hour, about 1 minute per call. They help the people in Boston with all types of concerns, like where to get free meals and laptops while schools are closed, how to get copies of birth certificates, questions about parking and street cleaning, and resources for seniors. You name it, 311 call takers are the people who help. I also want to thank the neighborhood liaisons. They've been picking up shifts at 311 and doing all kinds of outreach in the neighborhoods they serve. Thank you also to everyone who has worked tirelessly to compile information, update our databases, and make sure all of our call takers get the latest information that residents need. So to our entire team at 311 and to our Office of Civic Engagement, I want to thank you all for your hard work and your service to our city. Now I'm going to open up for some questions. I have a few previous questions that I'll read, and then I'll take questions from the press that's here. A question from Deja Moore at the Boston Globe about research from Northeastern University that estimates there were undetected cases of coronavirus in Boston before March 1st. There's 3 questions and I'll answer them all at one time. Does the mayor believe, knowing what he knows now, is that this is likely? What might have the city done differently if we'd had perfect clarity back then in early March? Given the lag in testing at a federal level, would there have been any way of detecting this beforehand? I haven't reviewed this research yet, but any data that shows more widespread infection, again, just shows the continued need for more testing. Of course, if we had seen the positive results earlier in March, we would have acted earlier, since every step we have taken has been guided by public health, the public health since day one. I'm certainly focused on what we know today, and the findings will gather more ways of data as we look through the surge and the information for the recovery. That's why we're working every day to increase access to testing throughout our neighborhoods, and this week we launched antibody tests for over 1,000 residents, and we're going to continue to try and increase testing and antibody testing as we move forward here. A question from Karen Riegel at WBZ. There has been an uptick in people calling 311 to report people not social distancing and not wearing masks. Should people be using 311 in this way? We need everyone to take the public health emergency seriously. The measures the city of Boston has put in place are already affecting ways to slow the spread of the virus. I urge everyone to take the public health emergency seriously by staying at home as much as possible, keeping 6 feet away from others when out, and wearing face coverings outside your home. And just to add a little more to that, as I mentioned, the 311 call takers are taking about 1,600 calls average a day. If people want to call 311, you can, but I'm asking people in the community to help us by putting face masks on so we can cut those calls out. It's really important that we do that. I've received several questions about reopening on May 4th. There's no question that May 4th is too early. The lives of our residents and the work of our businesses have been uprooted for weeks. Many are facing financial hardship, and we know that the economy and the people's livelihood are on the line. This is not a moment that there's never a moment we don't think about that. But I'd have serious concerns if we start relaxing some of the measures we've taken in Boston and across the Commonwealth on May 4th, especially if it's done without clear and thoughtful plan. Our residences and our businesses need transparency, whatever level of predictability we can offer during this unpredictable time. I can tell you right now, Boston will not reopen on May 4th. We need to determine what the public health benchmarks are. The question can only be answered when it's safe to begin relaxing some of the measurements, when we have a chance to look at the information, look at the data. We can inform what protocols need to be put in place to allow this to be done safely. That's exactly the work that we're working on here in the city of Boston. I know on a state level we're part of a task force that was appointed by the governor that's going to be looking at these benchmarks and looking at how we reopen society safely. We are currently building a recovery framework in the city of Boston that will give us a guide for short, medium, and long-term recovery. This will need to be a plan that can be adapted as quickly as the virus can change on the situation. It will need to include public health interventions to ensure the spread is minimized until a vaccine or treatment is ready. Our goal will be to prevent further spikes of the coronavirus and reduce both health and economic inequities during recovery efforts. I can't stress that enough. We can't afford to make any mistakes. We are not going to sit back and wait for the coronavirus to go away to take the next step, but we are going to approach it very thoughtfully. We should never put ourselves in a position where we move too quickly and undo the progress that's been made. I want to say to the people of Boston, we may not have all the answers at once, but as soon as we know our plans, what they are in Boston, we're going to share them with you. From the beginning of this crisis, I have promised to be upfront about why we're making certain decisions, and I'm going to continue to stand by my promise. With that, I'll open up to questions for the press.
1,000 people will be tested. Are they chosen at random, or are they affiliated with the city somehow? And when will the results be?
The question is, the 1,000 people for the antibody testing, was it chosen at random, and how it was chosen, and how they were chosen, and when will the results be in? I'm going to ask Marty Martinez, Chief of Health and Human Services, to answer that.
Yeah, so the 1,000 individuals were randomly selected into the 4 different zip codes, and they'll be tested over the course of this week, and then the results should be available into next week. So it'll give us some indication of the spread of the antibodies, or the spread of the virus within these neighborhoods.
The question and the comment was that Somerville today instituted a mandatory face mask wearing and a potential $300 fine. And it begins Wednesday. And if Boston's considering anything similar as far as the fine, we have not taken that step yet. I will make sure. I just found out when I was walking down here that Somerville did that, so I'll probably give the mayor of Somerville a call today to talk to him about it. We have not done that. I don't want to say we've been hesitant to do that, but I've been trying to ask people to do it voluntarily so we don't have to put restrictions in place. I think any time that we have to put some restrictions in place with penalties and things like that, I feel like we shouldn't be having to do that in these times. If we need to, we will. I know that New York has fined people $1,000 as well for similar actions. But again, I'm asking people, this week is going to rain. It's cold today and rainy, and it's going to rain tomorrow. And next weekend, we're looking at a 60-plus degree day on Saturday and a 70-degree day on Sunday. Obviously, the weather's going to start to turn now, and I don't want to have to go to a position where we have to penalize and fine people for not wearing masks, for keeping themselves and other people safe. So I'm hoping that common sense prevails in this particular case, and people start realizing the common sense of it. Yeah, I'm assuming that's a piece of legislation at the State House. Is that what it is? Well, let me just. The answer is the city of Boston would support some regulation for grocery store workers to be treated in some cases as first responders as far as pay and things like that. Certainly, I certainly would personally. Any other questions? And you can also, right in front of me, phone numbers for the texting line. If you're not signed up for the texting line to get daily updates, please sign up. And also, we have those text messages in 11 different languages, so we can help you with that as well. And with that, I want to thank everyone for coming out today, and to the people of Boston, continue to be strong day at a time.